Sheep producers know the importance of animal welfare. Sheep that are well treated are more productive and profitable than those given a lower level of care. As well, public opinion and consumer confidence decreases when cases of animal abuse and neglect are publicized. We know how animals are treated is important. However, the details of what constitutes proper care can be complex. The National Farm Animal Care Council, or NFACC, Code of Practice for the Care and Handling of Sheep provides a guide to accepted animal care standards for sheep farms in Canada. The standards integrate practical on-farm considerations, regulatory requirements, and animal welfare research results. The code is divided into 7 sections. Each section focuses on an area of management that influences animal well-being. The sections provide information and the management practices needed for proper animal care. In this video, we will take a closer look at Section 4 of the Code, Health Management. This section is divided into 4 chapters. A brief overview will be given for each chapter, and producers are encouraged to review the code for more details. The first chapter discusses the relationship between animal health and animal welfare. The link between health and welfare is clear. Health issues cause pain and discomfort, impacting animal well-being. Good animal health, therefore, is necessary for good welfare. Preventing problems is always preferable to dealing with sick or injured animals. This is true for both minimizing animal suffering and for avoiding production losses. Health issues are more easily avoided if producers develop organized prevention plans. Setting up health plans will be discussed more in Chapter 3. Maintaining records, such as monitoring the incidence and treatment of disease, will help reduce the impact of health problems, both on an individual animal basis and for the entire flock. Keeping records, whether by using a pocket notebook or computerized system, can help producers monitor current situations and plan for the future. Chapter 2 deals with the importance of stockmanship skills for maintaining animal health and welfare. Handlers possessing strong stockmanship skills are able to prevent or minimize health issues by knowing what to do and taking appropriate action. Everyone working with sheep must know their basic care requirements and have access to a copy of the Code of Practice. Handlers must be familiar with normal sheep behavior and with signs of illness and injury. As with all prey animals, sheep tend not to show obvious signs of illness until the condition is advanced. Knowing subtle signs of discomfort will help handlers catch problems early and minimize animal suffering. This knowledge helps handlers quickly assess the severity of the problem, how to manage the situation, and whether veterinary help will be required. The more quickly the assessment can be made, the more likely it is that the problem will be contained. All handlers, including producers and employees, are responsible for becoming competent in required skills. For example, learning proper techniques from an experienced stock person before performing procedures such as tail docking and castration. Producers are responsible for training employees before they are left in charge of caring for sheep. Sheep need to be monitored frequently to ensure the early signs of disease are detected. An increased frequency may be needed at certain times, such as during lambing or periods of poor weather. Handlers need to contact a veterinarian if they are unsure of how to handle a situation, particularly if a reportable disease is suspected. The third chapter of the Health Management section discusses the importance of veterinary care and flock management programs. A flock health and welfare plan should cover the yearly production cycle. The complexity of a flock health and welfare plan will differ depending on the flock size and circumstances. For instance, in a small flock, a structured discussion between the producer and veterinarian may be sufficient. In a larger flock with employees, a written set of standard operating procedures, or SOPs, should be available to all handlers. Plans should be reviewed annually. Many elements of an effective health plan are included in the National Sheep On-Farm Biosecurity Standard and Planning Guide, available from the Canadian Food Inspection Agency. The planning guide helps producers assess health issues of greatest risk and develop a disease prevention and management plan unique to their flock. Plans could include parasite control and vaccination programs, and/or procedures for containing the spread of disease, pain management, and euthanasia. As mentioned earlier, record keeping is an important element for all health management programs. Having a working relationship with a veterinarian helps ensure he or she is familiar with flock management practices. This will help when establishing and implementing effective flock health plans and could save time in diagnosing and treating health problems. The fourth and final chapter of this section deals with sick, injured, or cull animals. Preventative measures can help avoid many health issues. However, there will be incidents of illness and injury, and handlers must ensure sheep are provided with timely and appropriate care. Catching problems early is essential for preventing animal suffering and limiting the number of animals affected. As discussed in Chapter 2, everyone responsible for caring for sheep must be able to recognize even subtle signs of sickness, injury, or disease. Signs include isolation from the flock, not eating, hunched stance, and any abnormal behavior such as staggering or agitation. A full list of signs of illness and pain are provided in the code, as well as a guide to assessing health and administering first aid. The Biosecurity Planning Guide provides information on identifying common sheep diseases and how to take action to avoid the spread of disease. There are times when nothing can be done to save an animal. When treatment fails or is not feasible, sheep should be culled, euthanized, or slaughtered on farm as soon as possible to prevent suffering. Animals should be culled early in the progression of a disease or injury before welfare or production issues occur. Only animals that are fit may be shipped, and only if there is no chance their condition will become worse during transport. The code provides information on how to make the decision to euthanize an animal and the approved methods of euthanasia. Only people that have been properly trained should attempt to euthanize an animal. Producers should consult with a veterinarian if they are uncertain. Health is an essential element of animal welfare. Taking time to set up preventative plans and action plans for dealing with health issues will benefit both the welfare and the productivity of a flock. Producers want to provide quality care to their sheep, and managing health is one of the best investments that can be made for animal welfare and flock viability. To download the Code of Practice for the Care and Handling of Sheep, go to nfacc.ca.